Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, with what's going on in Harrisburg and Washington, we're obviously looking at cuts in the entitlements, particularly Medicare. One of our experts, Dr. Stuart Shapiro, is in the House. We're going to chat with him about that. And then Terry Fitzpatrick, a former member of the Pennsylvania Utilities Commission, is coming on the program. We're going to talk a little bit about the Marcellus Shale impact fee, all of that and more when Pennsylvania Newsmakers returns.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back. Well, I think there isn't any doubt that one of the big looming challenges before Congress and the President is what to do with the entitlements. 75 million people 2007 began to become eligible for Medicare, and then over the next 25, 30 years in Social Security. Dr. Stuart Shapiro is here as often in the case. He's one of our go-to guys when we start talking about all things health care and today, particularly Medicare. Dr. Shapiro, welcome.
Hi, Terry.
Well, look, let's get into this business of Medicare, and you can tell me if I'm wrong. When I look now at what's going on in Washington and Harrisburg, it doesn't seem that they're looking at Medicare reform holistically. They're saying, let's just cut the providers. And not the recipients, but the providers are, maybe I'm on Mars here, but it looks like it's just cut providers, cut providers, cut providers, and you all do more with less.
Well, the elderly in Pennsylvania and across the country are being hurt by the Congress of the United States today. Every time they look at balancing the budget, they say, where can we find a pay for? And in the last 2 years, they have cut Medicare, and especially to the frail elderly who are in nursing homes. Now, first, Obamacare.
Yeah, but let me pursue that a minute. Are they hurting him by lack of funding, or are they hurting it? I mean, I was told, and you'll correct me, you're the expert, that it was mostly provider cuts which then got translated into damage. Or you're saying that they're actually cuts themselves that, go ahead, finish. You see where I'm heading here.
Oh, no. The reality is, and I'll use nursing homes as an example. Pennsylvania nursing homes, the quality has improved dramatically over the last decade. It's the best in the country. What the Congress has done is they've said we're going to cut back funding. And if they cut back funding, staff has to be cut back because the margins or the amount of revenue in nursing homes is so thin today. They have so little room. And then when you combine it with the Medicaid problems in the state of Pennsylvania, it's a real double whammy. But let me be very specific. Obamacare took $15 billion out of care for the elderly in nursing homes. Then along came further deficit reduction last year, and they took because the super committee failed, they took another 2%. And then last week or last month at the end of February, they took another $50 million out of Pennsylvania Medicare.
So what you're saying is that when they do these cuts, it means that you'll reduce staff, you'll reduce programming, all the things that make nursing homes and hospitals and other healthcare institutions function are squeezed, and that ultimately affects the quality of care. It seems logical to me.
Because of these Medicare cuts, 37% of the nursing homes are reducing staff. They're delaying renovations. They're cutting back on benefits, and all of that leads to turnover. But the problem isn't just Medicare. It's Medicaid. 2/3 of the patients in Pennsylvania's nursing homes are paid for by Medicaid. Historically, Medicare has supported the chronic underfunding, or paying far less for the care than it really cost. Now, with the recent budget from Governor Corbett, who's facing serious challenges, the whole industry is on the verge, the whole profession, of being destabilized. And we're seeing hospitals telling us that their discharge planners are having difficulty placing or putting into nursing homes
people,
individuals on Medicaid.
Right. So people who go, who should be transitioned, it's now become extraordinarily difficult to do.
And that's causing backups in hospitals.
30 seconds left in this segment. I mean, this crisis has to, at some point, reach a breaking point, doesn't it?
Well, we're working with the Corbett administration to restore the cuts because I know they believe and are committed to the elderly. We know that Governor Corbett and the legislature cares about the elderly. And we believe that in the end, they will recognize that the care, if you want good care for the elderly in nursing homes, you must pay for it.
That's a good analysis. All right, we're going to go to a break. When we come back, I'm going to ask Dr. Shapiro what can be done to cut costs, what isn't being done. Are there savings that can be made that don't affect patients? He's going to help us out with that. We'll be back after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hey, welcome back to the program. Well, Dr. Shapiro is in the house. He's one of our experts we go to when we have talk about all things healthcare. Let's, as I said before the break, let's talk a little bit about, let's discuss this business of what's being done and what could be done to reduce costs without reducing access and the quality of care. I think I got that right. Access and the two things that I know you and I have chatted about.
Well, regulatory reform is always important because whoever is providing health care is subjected to lots of duplicate regulations which need to be changed at the federal and state level. And I must say the Corbett administration has articulated a vision of reducing regulations, and we're actually working with them to do that, and that's good. But there's a second area that is costing every consumer dollars every day in the healthcare system, and that's the lack of real tort reform or lawsuit abuse reform. There are lawsuits being filed in Pennsylvania against healthcare providers every day that are frivolous. Hundreds and hundreds and hundreds of them. And what they're being filed primarily by out-of-state trial lawyers who have seen the rating of Pennsylvania as the best climate for trial lawyers in the United States. Pennsylvania's consistently rated there. And so they come in, they advertise.
Oh, we see the advertisements all the time.
Yeah, and they say, we're going to file all these lawsuits. And then what we're going to do is we're going to go and say to these providers, oh, come on, settle with us for $50,000 or $20,000.
I get it.
And then they settle, and then they file another lawsuit, and it takes up a lot of staff time. And what this legislature needs to do is pass real tort reform. Now, the House of Representatives passed a bill led by Mike Turzai and Harrisburg legislator Glenn Grell. They passed a bill of real tort reform because it puts limits on punitive damages.
And is that now in the Senate?
It's now in the Senate.
It's always been a little tougher going in the Senate for tort reform.
The trial lawyers and their associations spend hundreds and hundreds of thousands of dollars a year on political contributions. They are supporting trial lawyers from outside Pennsylvania and also, of course, from in Pennsylvania. But there is a real need for lawsuit abuse reform. It's sitting in the Senate, and it needs action.
Well, what's your sense about whether there will be action?
Well, it's an election year, and it's a controversial issue. But if the Senate is serious about improving quality of care and letting staff in hospitals, in nursing homes, in doctor's office spend time and attention caring for patients and not just responding to frivolous lawsuits, the system would improve, the quality would improve, and dollars would be saved.
And are you reasonably tough year, election year. You know, lawsuit abuse reform has been on the agenda for a long time. Governor Rendell, I think, in all candor, was not crazy about it. I think that's safe to say.
Governor Corbett has made lawsuit abuse reform.
That's right. Corbett has, and
we passed one,
no.
and the legislature did pass one piece, but that is only a small piece of what needs to be done. And frankly, I've stopped handicapping elections or legislative battles.
People think I ought to too, but go ahead.
But that's what you do, not me.
Well, we'll see. Well, look, as always, I want to thank you for coming on. I think this is a great update, and you'll keep us surprised as we move along. It looks like, my bigger point before you go is that I've argued for a long time that we're staring at, and you pick the number, $65, $85 trillion in entitlement reform problems. Unless we do this is what we're facing in 25 or 30 years. And that means not just cutting, but it means figuring out a way to broaden the support base, you know what I mean, to figure out a way to pay for this. At the same time, we don't damage the folks who need it. And Congress will not do this. You know, as you point out, they just sit and talk and don't do it.
And there are solutions. It's going to require people having serious discussions and moving away.
And political courage, right?
And political courage, and stop just a lot of rhetoric. But it can be done, and we've got to do it because we have 10,000 Pennsylvanians turning 65 every single day.
That's exactly right.
And if we don't address that problem, they're going to have no place to go for their medical care.
And with the affordable health care, the concern is that we'll have fewer doctors, and most of them will be attached to an institution. That's nothing inherently bad in that, but the entrepreneurial nature of it, where doctors can work a few more hours and make all that will be gone. And everyone I've talked to, experts say we got real concerns about access and quality.
Well, the real issue is with Obamacare, that it increases the number of people that will be on Medicaid, which are paid for this year, will be paid for next year. But come 2015, the burden on Pennsylvanians from that legislation are going to be just incredible, and there's no way that Pennsylvania can afford to assume the burden that's being shifted from the federal government to the state government.
Great point. All right, we're shifting gears. Terry Fitzpatrick is here. He's a former member of the Public Utilities Commission. He now heads the Energy Association. We're going to talk a little bit about the impact fee and Marcellus Shale and some other important energy topics that you want to pay attention to. And we'll see you in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education, 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Well, here we are with Terry Fitzpatrick. He comes on. We always bring these experts on. These people know a lot more about it than I do, and that's not hard to do. Terry Fitzpatrick, he heads the Energy Association. He's also a former member of the PUC, Public Utilities Commission. Before we get into the impact fee, hold on. Higher oil prices, lower natural gas prices. Mr. Fitzpatrick, can you explain this? What's this all mean when we got these things going in opposite directions to the consumer?
Yeah, you do have a split in different types of energy prices. Gasoline prices, of course, are going up, and they're very much affected by things going on in world markets and by things going on in the international scene. And of course, there's a lot of unrest in the Mideast, and you have some other things going on, like the refinery closing in southeastern Pennsylvania. All of those things are affecting gasoline prices and causing them to go up, hitting people in the pocketbooks. But at the same time, the price of other forms of energy, particularly our members provide natural gas service and electricity service. Those prices are going down, because, and that's affected, I think, by the new gas supplies that we have.
Is that Marcellus Shale?
Marcellus is having a very beneficial effect to consumers.
Well, now,
At the same time, weather, you know, the warm weather we've been having is also, certainly in the short term, causing even furder reductions in those prices.
That means reducing demand, therefore,
yes.
the supply is still there?
Yes.
Is that what's going on?
So under the markets, the price go down.
UGI and lowered their rates, and so did PPL. Is
Correct.
that part of that?
Yes, that's directly
so we got
tied.
Natural gas, right, is one gas, and the other is electricity, right?
Yes, and electricity prices are also tied to natural gas, because natural gas is an important fuel in generating electricity, so wholesale electricity prices tend to follow the wholesale price of natural gas.
Now, does it, coal-fired power plants are being reduced? There's one or two in PA that are leaving. Does that have any? Does that mean we rely more on other ways to generate electricity? And does that have any effect, or not, probably not, on the market, or is it more the things you've just been talking about?
Well, I think in the short term, I don't think that's affecting prices. Over the longer term, it could, because I think most experts feel that with the new environmental rules, with some coal plants perhaps closing, that we'll be relying even more on natural gas.
So there's no need. So what to bring this to a closure? Higher gas prices may affect driving cars. But in your home, if you're affected by, if you use natural gas or some electric companies, you'll see lower costs, at least in the short run, right?
That's certainly true.
Now, if natural gas prices go up, then
those prices will tend to go up, and markets do go up and down. I mean, you can't expect prices to stay down forever. But one of the other things that's coming out of this split that you talked about is that people are talking more and more about using natural gas as a transportation fuel, and there's even some encouragement of that in the Marcellus Shale impact fee legislation, which I know you're interested in.
Yeah. Now, how does that? I mean, natural gas you're using cars?
Yes.
Now, does that? I mean, you're talking a guy who studies politics, so you're into an area where, I'm a little clueless. Hosts are never supposed to say that, but does that mean cars you'd have to get cars that? Does that mean big changes in Detroit and other places in the way?
Yes, you have to have cars that are designed to burn compressed natural gas. And then you have to have, of course, the infrastructure with the filling stations, too. And that's all a lot of money. But there are steps being taken to gradually start to move us in that direction and see whether it's something that's viable.
And natural gas is a cleaner form of energy.
Correct.
And as opposed to oil. And it would also help reduce our dependence on Middle East, although, as you know, Saudi Arabia is, they're not we get our oil from Canada and Mexico. Correct. And not totally the Middle East, but what happens there affects world prices, particularly in China, Russia, and I guess all of Europe, right?
That's correct, and it's a worldwide market, so everything that happens there affects the prices that we get from anywhere.
All right, we're going to talk about this impact fee that was imposed by a state legislature, a law that would, in a sense, tax the producers of natural gas in our state in the Marcellus Shale zone. It's something that's very controversial. We'll talk to Mr. Fitzpatrick about that and what it means to you following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hey, welcome back. We're chatting with Terry Fitzpatrick. We got from the Energy Association. We got some great stuff about the prices of oil and natural gas, and you all know about Marcellus Shale. The legislature a couple of weeks ago passed Marcellus Shale law that has all sorts of aspects to it, but one of them has to do with something called the impact fee, which you're going to tell us about.
Correct, yes. After a couple of years of debate trying to get it done, and I think everybody realized or thought it was coming, finally the legislature and the governor were able to agree on impact fee legislation, which allows counties the decision, at least in the first instance, whether to collect a fee from the drillers of natural gas in the Marcellus Shale.
And you know, what was first of all, it's controversial because obviously Governor Corbett had made this no tax, no fee increases during his 4 years, and they had to move beyond that. And you know, there were lots of recommendations from different organizations that, and an official one, you know, that said do the impact fee. The big question that I hear about it is whether the impact fee is, Democrats very critical of because they say it's not high enough. Republicans say let's start there. Do you think the impact fee is high enough? I know that's a tough question, and some have said we just have to wait and see how it works.
You need a reasonable balance on these things,
right.
And the trouble is that's very much in the eye of the beholder, particularly in this time when there's so much, can be partisanship and such a divide. The fee that was imposed, I will say this though, it will float to an extent with the price of natural gas and with the consumer price index. So if that price goes up, if the producers are making more money, they will then be paying more.
Right. And you think of the way they could have done it, are you comfortable with that way, that lets it float with inflation, I guess, and the price of natural gas? Is that...
Terry, I think that makes some sense. And the point I would raise here again, and this goes back to our earlier conversation, don't think that these taxes that the Marcellus producers pay are the only public benefit to this. I talked about how it is helping to keep your natural gas bill down, your electricity prices down as well. And then there's the jobs, of course, that it provides. So there are a lot of benefits from this, even though there continue to be different opinions on how heavily they should be taxed.
Yeah, I mean, you're right. There's just a whole series of concerns. And my sense about this is, and I've talked about this before, whenever you get a big piece, you followed this, of course, from your PUC days, when you have a big piece of legislation that passes, people say, well, won't they amend it? Won't they change this or that? Not likely to, I mean, I think they're likely to give this some time, you know, to see how all the parts work and not begin the tweaking for a couple of years.
I think that's right. I think the big point I would make is, and I read this morning reading some of the commentary on the legislation, is let's not set up the perfect as the enemy of the good.
Right.
It was certainly a step forward in terms of the rules that were imposed, some of the new environmental rules, in terms of finally getting a fee on the gas production.
Right.
So it's certainly a step forward.
Right. Well, look, as always, thanks for coming on. It's very, very helpful. You'll come back when we'll see what else comes up along in the energy development. Hey, I want to thank you for watching, as always, Pennsylvania Newsmakers, and stay well. We'll see you next week.